Hi, my name is Kerensa. I'm a clinical operations manager. I've been in this position for roughly 7 years, and for about 15 years prior to that, different roles within clinical research for monitoring, project management, and some staffing, actually. The role primarily manages the vendors, all of the trial agreements, all the processes that happen during clinical trial development and clinical trials being run, period. So a lot of work goes into that, very hard to encapsulate it within a few seconds. My experience with advanced clinical services dates back for the past almost 15 years. Under different scenarios, I've worked with them as a contract basis, as a contract monitor where it was a W-2, and then again as a 1099. In both of those situations, very little managing was required from advanced clinical. It was more handled through the sponsor, but always my payments, my benefits, all my communications, any type of report to was handled through advanced clinical, and it was, professional, streamlined, concise. Past that, they were able to place me in a permanent role just recently, and so this is the first time I've had the opportunity to work in a permanent placement situation with advanced, and it was handled very responsibly. There were some mitigating issues that my staffing agent was able to really help me get over, so there was a lot of hand-holding and generosity of time. In relationship to the rapport that I've had with the different members of the advanced clinical team, while I was both in placement and while I was working on other projects where advanced clinical wasn't a part of the hiring process, they kept in frequent contact, as frequently as I would agree to. So if quarterly was too often, then they would agree on a different time scale, but always made sure to let me know that there's just the right opportunity. This position really fits your background, it fits your interests. They always seem to keep a running tab on where I am, what my likes and dislikes were in the past, and what I'd be looking for. So when a niche position would open up, I would get it in real time. And it made all the difference in this type of environment to be one of the first people on the ground and at the front of the door to a potential new hire.